Marie Fuentes, a BSN second-year student of Visayas State University. Now, we will perform the newborn care. Let's go! First, we need to prepare the necessary equipment that's needed. Second, we need to do hand washing. Third, we need to put our PPE to protect ourselves and the patient. Hi everyone, it's me again, your student nurse from today, and now we're going to do newborn care. And before that, wait, we'll need to protect ourselves first and we'll do the PPE. In doing newborn care, we need to remember 4 newborn care practices according to the DOH protocol or Unang Yakap. First, immediate and thorough drying. Second, early skin-to-skin contact. Third, properly timed cord clamping. Fourth, non-separation of newborn from mother for early breastfeeding. In preparation, we must need to prepare 2 pairs of surgical gloves, 2 warm blankets, bonnet, a cord care set, erythromycin, vitamin K, and hepatitis B shots, and check your resuscitation equipment. The next is hand washing. At the perineal bulging, prepare for the delivery. Call out the time of birth and position the newborn to the mother's abdomen or chest. At least dry the newborn for 30 seconds. Wipe the eyes, face, head, front and back, arms, and legs. And do a quick check of breathing while drying. Take note of the following: do not wipe off the vernix, do not bath the newborn, do not do foot printing, no slapping, no hanging upside down, no squeezing of the chest. Cover the baby and the mother with a clean blanket. Put on the bonnet to the baby. Place identification band on ankle, not wrist. After 1 to 3 minutes, you need to do properly timed cord clamping. First, we need to remove the first set of gloves. If you see that the umbilical pulsations have stopped, clamp the cord using a sterile plastic clamp or tie at 2 cm from the umbilical base. Clamp again at 5 cm from the base, and then cut the cord close to the plastic clamp. Note, Do not milk the cord towards the baby. And then after the first clamp, you may strip the cord of blood before applying the second clamp. Cut the cord close the plastic clamp so that there is no need for second trim. Do not apply any substances on the cord. You need to remember the 10 rights of medication administration. First, right patient, right medication, right dose, right route, right time, right patient, education, right documentation, right to refuse, right assessment, right evaluation. In doing the eye care, gently pull down the newborn's lower eyelid. Extrude a line of ointment the length of the lower eyelid from the inner canthus outward. Discard any remaining ointment that is to prevent from being used again. 0.5 ml of hepatitis B is withdrawn, and it was also wiped with wet cotton balls and then administered injection at the anterolateral muscle of the newborn's thigh. The next is 0.5 of vitamin K is withdrawn, and then also same process, wipe the site with wet cotton balls and then administer it injection in anterolateral muscle of the newborn's thigh. And then check the newborn's condition and vital signs. Remember to record all the documentation. And now, after 6 hours, we need to do the newborn's first bath. First thing we need to do is, after we put all the necessary things that will needed, it is important that we need to prepare ahead before putting the baby or getting the baby a bath, because it is to prevent the baby unattended. So first thing we need to do is we need to change or get the diaper of the baby. Discard. And then after that, you need to cover half of the baby. First thing we need to do is we need to clean the baby from the cleanest to dirtiest. So we need to do head to toe. We have a basin of water here. First thing we need to do is we'll get a clean towel, and then we're gonna dip it in the clean water, and then we need to clean first the baby's eyes, so inner to outer. The other side. And then after that, we need to clean the baby's face also. Need to clean the baby's ears, the baby's face, and we need to clean the baby's leg, because some of the milk will be or like spit out in this area. So you need to be careful to really clean this part and give a baby a little bit. Okay, now we're done. After that, we need to wash the baby's head. And in washing the baby's head, you need to carry the baby, put it like this. So you need to hold it like this, like you are playing a football. Then you need to wash the baby's head with water. Then we have soap. And you have a comb here. It may look so sharp, but it's not. It's good for like baby. It's used for babies. So we need to brush it in circular motion. Gently doing circular motions. After that, we need to wash the baby's head. Take out all the soap. After that, we need to clean the baby or dry the baby. After drying the baby, we need to now wash the baby's body. And now let's wash the baby's body. Here we need to remember not to soak the cord. So we need to wash the baby's body. Give it a water. And then soap. You need to support the head of the baby. After that, so clean it with water. Make sure that there's no soap on the baby's body. So let's try a little lift of the baby for the back, like that. Put it with water, with soap. Soap, put it with water. After making sure that there is no water left, so we'll put back the baby. The baby is girl, you need to clean inner to outer. And then dry the baby. Drying the baby. All done. And now after the baby is dry and after the baby have skin to skin contact, we need now to do the aftercare. So we need to dress up the baby and put some diaper. We need to open this up first. Put the diaper. What's up, the baby? So in doing this, in doing the bath, you need to talk to the baby because baby is like new to this. So they might be their reaction might be crying. So it's just the way of talking to us. Always remember that we use other gloves from bathing the baby and from changing the baby. That's it. Now the baby is ready to go back to his or her mother. The erythromycin is a topical antibiotic used in the eyes, often in newborn. It is effective against gonorrhea and chlamydia organisms. It is a drug of choice for a prophylaxis at birth. The possible adverse effect of erythromycin is mild irritation and conjunctiva, slight blurring of vision. The vitamin K, the dosage needed is 0.5 to 1 mg. It is used to prevent and treat hemorrhagic diseases in newborns. Necessary in the component for the production of certain coagulation factors and is produced by microorganisms in the intestinal tract. The possible adverse effect of vitamin K are local irritation such as pain and swelling at the injection site. The Hepatitis B vaccine, this is to prevent the severe liver diseases that can develop when children or adults are infected with hepatitis B virus. This is given as a series of 3 shots in 0, 1, and 6 months of life. The possible adverse effect is sore in the leg from the shot and low fever less than 37.8 degrees Celsius.